Welcome back, Source Nation. You're listening live to Healthy Living with Dr. Julissa.
Good evening, Source Nation and Facebook family, and welcome to another edition of Healthy Living with Dr. Julissa. I'm your host, Kathy B. Well, I am so excited to be with you all this evening because we have another dynamic show tonight. Tonight's conversation is all about pre and post menopause. But before we get into tonight's show, I want to thank some amazing people. Vita, yes, she came in tonight and she has given us some great exercise tips. And then, of course, up first at 6 p.m., Chef Keith came in and gave us a delicious meal. So what I need for you guys to do is to go out to Facebook. That's right, go out to Facebook, Kathy B, Source Radio Network, as well as our regular page, Source Radio Network, and get more information on tonight's healthy meal as well as exercise tips with Vita. Well, you guys know what time it is. That's right, Dr. Julissa Hernandez is here in the studio with me, and tonight we're going to be discussing pre-menopause and post-menopause. Now, Source Nation, you have sent in a lot of information in reference to tonight's topic, and I must admit, most of our Source Nation family, I can sympathize with you because I'm actually in this era of my life as well. And I think that this is a very important topic that we need to discuss. So Dr. Julissa is coming in and she's going to give us that excellent information in reference to tonight's subject. I do believe that she's here with us. Dr. Julissa, hello and welcome to Healthy Living. How are you this evening?
I am feeling absolutely divine, my sweet friend. So excited for Source Radio TV to be on screen with you this way and interacting with the fans and your fan. Oh, I love it. I love it.
I know. I'm excited. Source Radio Network Television has been going strong with all of our shows. And now that you and I are actually together live on screen, I am definitely excited. So if you will, Dr. Julissa, take a moment to introduce yourself to the Source Nation family and our Facebook family, and we will begin tonight's discussion.
Thank you so much for having me, Kathy. Hello, everyone. I'm Dr. Julissa Hernandez, naturopathic doctor, practicing now for close to 23 years, an international speaker on natural medicine, a teacher of natural medicine as well, television and radio personality, and honored to be here on this platform with all of you. Kathy, thank you so much for having me.
Again, thank you, Dr. Julissa, for being here. Well, tonight's discussion, again, Source Nation and Facebook family, is on post and pre-menopause. And tonight's discussion, we wanted to talk about, Dr. Julissa, some of the symptoms. We've actually received some letters from some amazing loyal followers of Healthy Living. And they're wanting to get the true understanding of pre-menopause and post-menopause. I want to take a moment and read something to you that I've actually found in some of my research. And maybe you could let us know from a holistic standpoint how we can begin to take care of our bodies in this state. Now, it says that menopause officially marks the end of female reproduction. Although this life stage is well known, there are actual different stages within menopause that are important for us to really recognize as well as understand. Now, menopause itself officially occurs when you stop menstruating. Talk to us, Dr. Julissa, about that, and is that actually true?
Well, a woman is only pre-menopausal if she has less than 12 months without her period.
Okay.
It's considered that you are already in menopause once you've gone a full year without seeing a menstrual period. I would think that spotting in that supposed time where you're skipping months and so on, you're still not in, as they say, menopause, still considered premenopausal.
Okay. Now, of course, Source Nation and Facebook family, I often use myself as an example. I have no problems in doing that. So I want to share something with you, Dr. Julissa, and maybe you can enlighten me as well as other family members that are watching tonight. I actually began menopause stage at the age of 35. I am now 47. Ironically, I have not had a menstrual cycle within the last 5 years, but up until approximately about a year ago, I had a cycle.
You had what?
Why. I had a cycle.
Okay.
And I don't understand why that happened, because, like I said, prior to that, 5 years, nothing. So talk to us about that, because to me, it would seem as though I'm still fertile and all of that. Can you explain that to us?
Absolutely.
Okay.
Hormonal balance has a lot to do with the time that a woman stops seeing her menstrual cycle. And that has happened in many cases that I've even been privy to with patients, where it stops, and even all of a sudden, after beginning certain herbal therapy programs, what happens is, I've encountered that many women, even though they may have stopped seeing a menstrual cycle, they sometimes feel symptoms like they might get it again, and they don't. Many times when I start working with them, and we're doing obviously balancing therapies, natural therapies, changing diet, changing certain lifestyle habits that are going to bring more balance and more energy, flow throughout the body, chi flow, as we say in Chinese medicine, then that cycle may start again. If we're balancing hormones, that's going to happen, especially if she's having an offset with her estrogen and progesterone levels. We have to bring balance there. I'm going to correct issues of estrogen dominance if it's a woman that has that sort of an issue. So that can bring on a period again. Also, if a woman has not been, I've noticed, sexually active for some time, and all of a sudden is now exercising that region, everything is flowing. There's more blood flow to that area because she is now having arousal. She is now having orgasms. In the arousal, it's the same thing that a man encounters when he has an erection. There's severe blood flow, a good amount of blood flow going to the genital region to cause her to be aroused. That goes to the G-spot, which is comprised of erectile tissues anyway, and that's going to want to crave blood flow to it if a woman is being aroused. And so that can also bring about another period to come back into her life and for her to start menstruating normally. Being sexually active, it's a muscle that needs to be used. And so if it's being worked, things are going to start working, quote unquote, again. So
wow. That is exciting. That's exciting as well as enlightening. So because if a woman has not been sexually active in a while, and she assumes she's in menopause, once, as you stated, once everything begins to flow again, she can now have an active cycle.
Yeah, that can happen more often than not.
Okay, so this is natural. It's natural.
Yes,
Okay.
it is natural, especially for those women that have their reproductive system intact, have not had partial hysterectomies, have not had any sort of myomectomies or any sort of surgeries. If they've had very healthy reproductive system still intact, and you could still get pregnant up until the point that you stop menstruating, that can definitely come back, and your menstrual flow can come back. And of course, fertility as well. And so if a woman's being active again and she knows she could still get pregnant, be weary. I've had a lot of happy accidents in the past 23 years and a lot of unhappy accidents in the past 23 years where, you know, at a certain age, a woman thought, there's no way I could be pregnant.
Right.
Well, now you're working with me, so here we are. Yes, we've had those.
And let's talk about that, because we've actually had a couple of family members that have written in and said, okay, I really felt, Kathy B, I was in menopause, and all of a sudden I am pregnant. So let's talk about that. So you're saying that now that she has become sexually active again, you know, in regards to fertility, this can happen because, one, she has not had a hysterectomy, so she has, you know, her fallopian tube, her uterus, all of this is intact. So she is now fertile again. Correct?
If you're getting a period, you're most likely ovulating too.
Yes.
And if you've changed your lifestyle, if you've changed certain habits, you're exercising, you're eating better, you're using certain natural therapies. I bring in natural therapies for a woman, whether she's in menopause or premenopausal, that are going to balance her again. And time again, I've even had them get upset with me. I thought I was done with this. Why is my period back? Oh, you no idea. And well, that means your insides are young again. You know, what are you going to do? And then you're ovulating, and most definitely you're risking yourself to possible pregnancy again. And that just tells you how youthful your inside, just really tells
Wow.
how youthful and beautiful and how balanced your inside is becoming again. And they get a little upset, but when I put it in that way, they're like, okay, you know. And it's wonderful because then they also feel more in moments of intimacy, if it's a woman that's being active again in that department, in a new relationship, and so on. You know, the body is a wonderful thing, Kathy. It really connects with also what's happening in their world. And when a woman is not in a relationship and at that time in her life, it can be that things shut down, and then once things get reactivated, everything starts to flow again. So it's just all nature and something that's unexplainable, but a beautiful thing.
Love that. Love that. You know, I want to talk about the transition, because I know this is a time of life where it becomes questionable, because if you have been in the state, just like as I stated earlier, I was 5 years, no cycle, and then all of a sudden it's here. So let's talk about the transition and how do we I guess accept the fact that we are still in that state. What are your thoughts about that? And what have you shared with your patients that are going through that ordeal?
I definitely recommend a woman to work on maintaining her nice hormonal balance. Because then I've also had the cases that when a woman thought she was already in menopause, started menstruating again, and yet still feels some of the uncomfortable symptoms that women who are not balanced experience during menopause. So please know that no hot flashes are not normal, no vaginal dryness is not normal, no skin dryness is not normal. You know, all of that happens when a woman is going through the changes of life. In the Japanese vocabulary, there's no word for hot flashes. So all of these issues are actually not normal. A woman who experiences all of those negative aspects when she stops menstruating is because she's imbalanced. So now the period is back, and many times you'll still have some of those lingering effects of symptoms that are associated with menopause. Then I tell them to bring in herbal therapies and to eat certain foods that are most definitely going to maintain her hormonally balanced. You'll find in an article that I'll share with all of you and your viewers that I've written on hot flashes, hormonal balance, and menopause, where I share their herbal therapies. I love red raspberry leaf. I love Damiana, which is a natural aphrodisiac that is also wonderful for balancing hormonally, that I love to use with women, especially if they are very sexually active and want to feel even more sexual desire and experience more sensitivity as far as, for example, orgasming, just to make things flow. I love to bring in also other therapies that are going to increase circulatory flow to the genital region, vitamin E with selenium, butcher's broom. So I have a combination of herbal therapies that I love to incorporate with women, so they're feeling very good as women, and so they're feeling balanced, not moody, which happens much of the time. Okay, the shift, you know, one moment you love him, one moment you hate him, one moment you're happy, one moment you're sad, and that happens, you know, if she's imbalanced. And so I make sure that if she's going back into the transition, it's smooth. We want to make sure that she doesn't have cramping, so these herbal therapies also help with internal inflammation. And then, of course, I never recommend tampons. What I would recommend is for them to continue using organic maxi pads, anything that is not laced with chlorine, so she doesn't have severely heavy blood flows. That's one fear. I've had some women tell me, but you don't understand, Dr. Lisa. I thought I was done with this because I was such a heavy bleeder. And I say, don't worry. Leave your body to me. That's my job. Let me work. and feed your body what we know it needs to, so you don't have to deal with a horrible period again. And so balancing in that way so that they go through it well.
Interesting. Very interesting. Because as you were speaking, I'm thinking about some of the that I've experienced. I've experienced, the cramping. I experienced the moodiness. I experienced the hot flashes. And to hear that this is, in Chinese medicine, it is not normal, or this is something that we should not be experiencing, but yet it's considered as hormonal imbalance. So you said that there were herbs that we can take, and you actually mentioned one particular herb that I take on a daily basis, which is butcher's brew. Okay?
Which is which one?
Butcher's brew.
Yes, I mentioned that one to you. Mm-hmm.
Okay. So I take that on a daily basis, and
Wonderful.
It has helped me tremendously. So in combination with butcher's
That also can bring on a period.
Oh.
Because we're creating blood flow. Because I know that you drive for long hours and things of that sort. We talk off screen for everyone to know. I treat my beautiful friend off screen. So yes, that makes good blood flow in the legs for all of you ladies out there that have issues with maybe numbness legs and so on. That can bring on a period again, because we're making blood flow. Forgot to tell you that one.
Yeah.
Yes.
See, Source Nation, I thought I was done. Now I know why.
Sorry. Here's another complaint. I'm sorry about that. Yeah, that's another reason, dear. Yeah.
Great.
And it's in my book too. I actually talk about that herb in my new book regarding helping women who have problems with fertility and imbalance of their reproductive system. And it's one of the herbs that I bring in.
Okay. Awesome. Now, I want to transition over. Dr. Julissa, I always like to speak upon the foods that we need to incorporate within our diet, the exercise. One in particular email that I did receive, this young lady stated that now that she is having a cycle again, it is very painful. She's not used to pain. So talk to us a little bit about that, because I think some form of exercises can assist her with the pain. And I also think, changing her diet now can assist her. Talk to Facebook and Source Nation about that. What are your thoughts on that?
That's very interesting. I actually did a Facebook Live video yesterday about a question that came in regarding a woman who was asking about her daughter. And she was also experiencing pain during her period and throughout actually the month when she doesn't have it. Now, we have to look into what could possibly be the cause there, apart from the fact that it is definitely inflammation. Pain, inflammation. I would love for you guys to kind of always keep that correlation in your minds.
Okay.
So I don't know where she's at as far as her hormonal balance, but most definitely let's balance hormonally, because estrogen dominance and things of that sort can bring those issues. So the herbal therapies that I just mentioned a moment ago, Damiana, red raspberry leaf, are wonderful things that I do bring in for that, but I definitely recommend her also using the organic pads, because what happens is when women are using those regular commercial over-the-counter pads that are laced with chlorine, your groin area is a damp, dark area, Kathy, and when you use that sort of a maxi pad, it will create a vaporish effect. These fumes can go up into the vaginal tract and actually cause the uterus to contract, which makes you have cramps and also makes you bleed more, so they can sell more. And so most definitely making those bits of changes, and definitely not eating high amounts of animal foods, especially foods that are so riddled with hormones, so that it doesn't cause the hormonal imbalance. Do that. I recommend her to do that so that she can correct those issues. And I'm also open to having a one-on-one discussion with her if she wants to reach out and if she's watching this, and we can help her that way as well. If before she stopped menstruating to then have it again, she was diagnosed with endometriosis and so on, I'll also share an article with regards to that, because for example, the Facebook Live video I did yesterday, the test that that daughter was doing was pointing towards endometriosis, which causes very painful periods. So we have to see if her endometrial tissue lining is really not shedding properly. That could be a cause for some of her pain, a number of things, but these herbal therapies help.
Right. We just got a message in, Dr. Julissa, in reference to this young lady has fibroids. So she was diagnosed with fibroids. She said that she did not have a period. She has not had a period within 2 years. But the fact that she has been diagnosed with fibroids, it has brought the period back on. What are your thoughts about that? And is that any correlation to what we just discussed?
If she has uterine fibroids, she most definitely has estrogen dominance. And
Okay.
the liver then is involved there. When the liver's overloaded, estrogen dominance sets in. So it's a vicious cycle where the liver, if it's not filtering hormones the way it should, that will happen.
Mm-hmm.
And so hormonally balancing. And with this question, I'll also share my article on uterine fibroids so that she can learn how to shrink them. But most definitely, hormonal imbalance is the issue there. And shrinking them is going to be ideal, so she's not seeing heavy clotting during her period, so she's not having that severe heavy menstruation and also the pain that comes along with it when women are suffering with fibroids.
Wow, great information that you're sharing. Source Nation and Facebook family, we are speaking with Dr. Julissa this evening in reference to pre and post menopause and the understanding of both and how your body can react and have some form of symptoms. Dr. Julissa, let's continue the conversation and give Source Nation and Facebook more information about pre and post menopause. What else are you sharing with your patients that you feel we need to speak on tonight about this subject?
Their diet is crucial. Diet is crucial to helping a woman maintain the hormonal balance that she needs to, so that she has a healthy menstruation. If it's already back, let's maintain that. I know that you've gotten used to most likely not having it. And if it's back, let's embrace it, okay? So one thing that I find that many women shy away from is, for example, soy. And there's a way to intake soy that actually is going to be helpful. And I know that it's an argument. I know that there's been a lot of going back and forth regarding the negative aspects of soy. However, when I discuss this, if we look at the traditional, for example, Japanese diet, it is very low in fat and high in soybeans. And so actually cooking soybeans, and that is the way that they incorporate that in their diet. I'm not just talking about soy foods out there that are already processed. I'm actually talking about the natural state of intaking soybeans. So the thing is that if the Japanese women in their vocabulary don't even know what hot flashes are, there's no such word for hot flashes in their vocabulary. So they must be doing something right. So knowing that and knowing the traditional Japanese diet, soybeans contain certain compounds called genistein and daidzein. And these are estrogenic, but they reduce the risk of breast cancer. And this is also known to very much reduce hot flashes and other types of menopausal discomforts. So that explains a lot. So I would say bringing that into the diet is a plus. Cooking them, actually soaking them, letting them become soft, and then cooking them, that I do recommend. Not necessarily just the processed foods that are soy-based. So making that naturally and making your own concoctions with soybeans is great.
Great information. Dr. Julissa, again, it has been a pleasure having you here on Healthy Living and giving us this information tonight in reference to pre and post menopause. You know, before we leave tonight's broadcast, if you will, please share with Source Nation if you have any suggestions or maybe some encouraging words in reference to tonight's subject. That would be great.
Definitely bring in all of those healthy foods. Greens are wonderful to also help you ladies out with helping blood flow and helping things flow properly. All greens contain natural chlorophyll, which will help with doing that. And one little bugger I need to put in there, if you are having any sorts of challenges with your menstrual period, most definitely reduce your alcohol intake to almost nil, as they say, because that is going to overload the liver even more, and you're going to cause even more hormonal imbalance. So that's my last little tip there. Oh, and coffee. Coffee will most definitely feed uterine fibroids, making them bigger, and makes challenges of endometriosis and menstrual pain worse. So those little tips there will help.
Thank you so much. And if you will please share with Source Nation and the Facebook family, how can we get more information about you and continue to support you in your efforts?
Thank you, Kathy. You can all find my information at drjulissa.com. That's drjulissa.com. And I so look forward to being here again with you next week, dear.
Thank you again, Dr. Julissa, and good night, Source Nation and Facebook family. And thank you for joining us live here on Healthy Living on Source Radio Network Television. Be blessed.
Good night.
Good night.